Marina Yanover. I'm a Gonzalez guardian. I'm a naturopathic physician and a licensed acupuncturist. I found Dr. Gonzalez online and I called his office and asked if I could spend some time at his office learning. And he said yes. And so I went to Dr. Gonzalez's office. I saw all kinds of patients coming in, patients who were diagnosed with incurable illnesses, mostly cancer, but some other patients who just had chronic degenerative diseases. And they all, from what I observed, improved and got better. They were very dedicated patients, and Dr. Gonzalez really took the time to be with them, and he probably spent an hour with each patient for a return visit. With a new patient, he spent a lot of time, 2 hours on one day, 2 hours on another day. And so really went into nutrition and how it all works and enzymes, and I got a chance to ask him questions and was very impressed with his answers. I started out in Ukraine. I got the nursing degree there when I was 18 years old, and then I moved to the United States. Before that, I worked for a year at the hospital there. It was impossible to go into medical school there because it was part of a Soviet Union at that time, and it was very bureaucratic country. So unless you had some connections, you couldn't do it. So I got the nursing degree, and I got a lot of experience during that 1 year, seeing a lot of difficult patients. I worked at a very famous hospital. It was called Marine Hospital in urological department. So it was almost like seeing patients after surgeries, doing a lot of IVs, doing intramuscular injections, doing some kind of wound healing and things like that. So I got that experience. Then I came to the United States and I decided to pursue my dream of becoming a doctor. So I went to college and did pre-med degree. And during that time, I was kind of disappointed in a way that American medicine worked. So I did some volunteering at the local hospitals in Brooklyn, and I was disappointed how they treat patients by addressing just the symptoms, never talking to any of the patients, never spending time with them, never using any natural medicine to treat the person. So at that time, I met a friend who introduced me to naturopathic schools. And so I looked into them and I fell in love with them. So after 4 years of college, I went to Pasteur University, which is considered a Harvard of natural medicine. And there I did naturopathic degree and an acupuncture and oriental medicine degree. So after 5 years, I graduated. And after that, I moved back east to Connecticut, where I did my residency for 1 year at the integrative medicine department at Derby Hospital. That was very good because I got a lot of experience in rotations with different medical doctors in different specialties like gynecology, pulmonology, radiology, endocrinology, and so on. Also helped students at the University of Bridgeport with their clinical rotations. So it was very good experience. And then I opened my own practice in Westport. So when I moved back east, I was looking, I had a lot of good interactions with doctors back in Seattle. I worked with Dr. Bill Mitchell, who was very famous naturopath and an herbalist. I worked with other doctors who gave me a good foundation. But when I moved back east, I used detoxification enzymes, nutrition, all of the aspects of the Gonzalez Protocol. I educate patients about the diet, what their right metabolic type is, how to eat properly, what kind of supplements to take, how to detox, and the results are amazing. Those patients who really, those are my favorite patients, those who really want to follow the recommendations and do everything. They have wonderful results. In my practice, I do treat chronic degenerative diseases. I specialize in things like autoimmune diseases, things like scleroderma, lupus, thyroid conditions like Hashimoto's thyroiditis, and Graves' disease, and other things like that. Skin diseases like psoriasis. I also do acupuncture. So part of my practice is also acupuncture, which is kind of a nice mixture of combining brain work when I sit down and think how to help the patient, and physical / energetic work with acupuncture. And I know that Dr. Gonzalez also treated Lyme patients, and I've seen patients with Lyme who used to see integrative doctors using a lot of antibiotics. But what I learned from Dr. Gonzalez, and I'm also learning it in my practice, is that sometimes none of it is needed. You just need to follow what your body needs, give your body a lot of nutrition, detoxification, and even with infections, patients improve and they don't need antibiotics oftentimes. They might need it initially if they just got bitten, but then after that chronic Lyme, oftentimes they don't need any of that. They need enzymes, they need nutritional modifications, they need detoxification, and oftentimes they are much better off like that. I like to let everyone know that I always believe there is no incurable diseases, and I want you to also believe that. If you have that belief, then anything is possible. And I wish you all the good health and good luck on the way to healing. And if you need me to assist you, I'm happy to do that.